A woman lived for almost a century without anyone realizing that she had her organs in reversed positions inside her body. Not her 5 children, nor her 14 grandchildren, 31 great-grandchildren, or 11 great-great-grandchildren. Presumably, even Rosemary Bentley herself never knew how truly unusual she was on the inside. Rosemary Bentley was born in 1918 in Walport, Oregon. After she died at age 99, her body was donated to science following her wishes. That is how she ended up in the dissection lab of the Oregon Health and Science University in Portland. One day, med students had to open the chest cavity and study her heart. They did and immediately began questioning everything they thought they knew about medicine. For starters, they could not find the inferior vena cava, a large vein that sits on the right side of the heart. They had to ask for help, and their professors were a bit annoyed that their pupils could miss something so basic. As it turned out, things were not so simple. Rosemary had situs inversus with levocardia, a rare condition where the vital organs were reversed inside the body. Her stomach was on the right and not on the left. Her liver was on the left, not the right. She also had multiple irregularities such as a right atrium twice the normal size and a right lung with 2 lobes instead of 3. The condition occurs in 1 of every 22,000 babies. However, most of them suffer from severe congenital heart disease and rarely make it past age 5. Rosemary lived to the ripe old age of 99 before dying of natural causes. Scientists estimated that she was 1 in 50 million. Had Bentley not donated her body to science, her medical mystery would have never been discovered.